So during the EHA 2020, we presented this prospective analysis of MRD measurement inside the bone marrow and outside. So with bone marrow techniques, flow cytometry and NGS, and with PET-CT as imaging technique. What is good in this analysis are 2 points. The analysis was applied to newly diagnosed transplant-eligible patient treated within the prospective phase 2 randomized trial Forte in Italy, randomizing patients to receive either Carfilzomib or Carfilzomib Cyclodex plus or minus autologous stem cell transplantation. So what is good is that all the patients were prospectively studied with the 3 methods. Of course, not all of them had all the methods, but a subgroup of patients where the 3 analyses were available. We were able to apply the Deauville scale criteria that we used in a previous prospective clinical trial, the EMN02. So this series of patients work as a validation of the Deauville criteria in myeloma. And what we found was that the Deauville criteria are reliable because they turned out to be reproducible in an independent series of patients. So we applied the definition of complete metabolic response as the disappearance of every FDG uptake either in the focal lesions or in the bone marrow below the liver level. This was the definition that we reached in our previous analysis, and we were able to replicate this in this prospective series of patients. The second point, that for the first time in a prospective fashion, we were able to compare the imaging MRD assessment with the bone marrow MRD assessment, and what we found was that the agreement within the bone marrow was very high, so 85–90% of agreement of the 3 techniques, while outside the bone marrow in the focal lesion, of course, PET-CT captured some patients with residual focal lesions that were negative with the bone marrow MRD techniques. So again, the complementarity between imaging and bone marrow techniques was confirmed, and of course this is another good point. In the present analysis, we did not have survival data available because the study did not meet yet all the numbers to perform the progression-free and overall survival analysis. So this data will hopefully come in the near future.